The materials for this procedure include a digital caliper, non-permanent pen or marker, and alcohol wipes for removing markings. Step 1 is marking anatomical landmarks. Ask the participant to place their hand in maximal radial abduction, demonstrating if needed. The arm and wrist are in neutral position. Use surface anatomy to locate the most distal dorsal aspect of the first and second metacarpal heads. To do this, it is helpful to first palpate the metacarpal phalangeal joint space. Draw a transverse line parallel with the joint. Another longitudinal line will be made parallel to the metacarpal bone and intersects with a transverse line to make a crosshair shape. The centers of the crosshair marks will make 2 points for which to measure the intermetacarpal distance, or IMD. Perform these steps to locate and mark the dorsal midpoint of the metacarpal heads on both a thumb and index finger. Bend the joints if needed while palpating, and return to 0 degrees before marking. In the instance that both radial and palmar abduction measurements are taken, the evaluator can use the marks previously made to measure the second type of abduction. After making the crosshair marks, measure the IMD using the digital caliper. Begin with the caliper closed, press on and then 0. The small prongs point toward the proximal forearm and the large prongs open until centered in the crosshair marks with tips flush to the skin. To measure the IMD in palmar abduction, again place the crosshair marks on the first and second metacarpal heads just proximal to the joint space. The thumb should be placed in maximal palmar abduction when marking. Mark the most distal dorsal portion of the metacarpal head with a transverse line. Palpate and make a longitudinal mark along the metacarpal. Again, bend the joint if needed while palpating for the joint space, but return to 0 degrees before marking. Measure the IMD starting with the caliper closed, turn on in 0, the small prongs are toward the proximal forearm. Before opening, ask if the participant can abduct any further, and then center the large prongs in the crosshair marks.